So these are the topics I want to suggest that you make sure that you focus on and don't miss anything so far as this particular exam is concerned. For me, I'm on a mission to drum it into the heads of everybody that we need to focus on nothing but the objectives, nothing but MCQ1 objectives. Okay. So if the topic is in objectives, you follow it. Now, the key objective is that given a patient with anxiety, the candidate will diagnose the cause, the severity, and the complications, and will initiate an appropriate management plan. So that is also another thing, how to initiate an appropriate management plan. And today, you realize that I'm going to focus on areas that many candidates don't focus on, whether in their tutorials or whatever. How do you manage a patient with anxiety disorder who has a comorbid substance use disorder? How do you manage a patient with anxiety disorder who has tried one SSRI? Which treatment plan is the best to start with? After you try an SSRI, what's the next option? What are the options available if a patient has substance use disorder, say opioid use disorder and anxiety? If you want to ace your MCQs, these are the areas you want to start focusing on, right? Not only reading about anxiety and anxiety-related disorders in general, but focusing on these key things so that you can be able to ace the exam. And you realize that is what we also do when we are testing our candidates in the mock exam. So today, I really want you to pay particular attention to this issue. So, given a patient with anxiety, the candidate will list and interpret critical clinical findings, okay, including those derived from an appropriate history and physical exam, aimed at differentiating situational stress from true anxiety disorder. Number two, ruling out an underlying medical condition as the cause of anxiety, for example, adrenal tumors. Number three, identifying possible comorbid conditions. You remember that I mentioned substance use disorder, substance-related disorder. Addiction medicine is a big thing in Canada right now. So even those who are planning on going into residency, plan on doing practice-ready assessment and all those things, that's an area I'll also encourage that when you get into your practice, you turn some attention to that because it's a huge need in Canada. And if we can get more doctors going into that field, that would be awesome. Okay. And determining the severity of symptoms and assessing for the presence of life-threatening features, for example, suicidal ideation. So you realize that the issue of suicide is big in Canada. And especially when you are learning for a mental health condition like anxiety and anxiety-related disorders, you want to make sure that you conquer that as well. That comes under depressive disorders, which is a whole objective on its own. But I'm happy that it keeps recurring. It keeps recurring so that candidates can pay particular attention to that. Okay, good. So another enabling objective is list and interpret critical investigations, including appropriate laboratory investigations based on clinical findings, for example, toxicology screen, okay, and construct an effective initial management plan, including ensuring the safety of the patient and others. And then another thing, treating the anxiety disorder using appropriate pharmacologic, environmental, that is hospitalization and psychological interventions, as well as treating any underlying medical or comorbid conditions if appropriate, and then providing support to family and or caregivers and referring the patient to specialized care if necessary. So today, as part of the class, after the initial lecture, I'm going to quiz you on all these things. What are you going to do if a patient has substance-related disorder? What are you going to do if the patient does not have substance-related disorder? What is the first initial management step for patients with maybe a particular unique form of anxiety? What will you do if that particular one fails? What medical conditions should you be thinking about if a patient presents with anxiety, which can present similarly to anxiety?